Good morning, everyone. I'm Yadukrishna, one of the deputy leaders in Endoscopy Department Treatment Center. So today I'll be presenting a topic called Managing Sustainability and Environmental Impact within Endoscopy. So before I start the presentation, I would like to thank Natalie Ward and Debs for giving me this wonderful opportunity to present this topic in the CUG session also. And I'd like to thank Ruth Harrison, who is going to be the Deputy Lead Nurse in Treatment Center Endoscopy soon. And she also shared her whole ideas to do this presentation and to present in front of you guys. So we will start this session now. So as I mentioned, we'll be discussing the topic managing sustainability and environmental impact within endoscopy. So we start with the quote. So the greatest threat to our planet is the belief that someone else will save it. So let's start. So what are the contents what we are going to look today? So the first one we'll be looking towards the impact overview. Second one we'll be looking to the climate change and health. Third point we'll be discussing regarding the current practices in endoscopy and what we can do as a team. And the last and final point will be the NHS green plan. Okay. The first point we'll be looking into the impact overview. In this point you can see that the NHS in England has a bigger carbon footprint than all the planes which is departing from the Heathrow airport. So that's a huge number, isn't it? So according to the size and reach of the NHS, it is unsurprising that its activities are responsible for 6.3% of the UK's total carbon emissions and 5% of the country's total air pollution also. So we are getting more and more numbers into adding into it. Endoscopy is a major contributor, or the third highest to the environmental footprint of healthcare, generating about 3.09 kg of waste per bed day. Yeah, and along with that, also in the calculations, it's also in the research, it's showing that endoscopy is the second highest in a monthly average, like corresponding to the clinical procedure base or the waste generating after clinical procedures. Endoscopy is in the second position, and the first one is carried by radiology department. So endoscopy is not far from there. So endoscopy is in the second position also. So these are huge numbers, and NHS green plan is to make the trust to become net zero by 2040. Okay, and we can see what are the climate change and health. So the climate change is a major threat to health and threatens to undermine the last 50 years of public health gains. And origin changes required, we all know, because without compromising patient care, clinical standards or training needs. And a sustainable health system will help with the following. What are they? So they are helps to prevent, the sustainable health system will helps to prevent illness and give greater control to patient in managing their health. And the sustainable health system also prioritizes the treatments and technologies with a lower carbon footprint. That's the main point. Okay, and coming to the next, so this is more interesting. So what are the current practices and what we can do? So in this picture it is depicted of, you can see what all things are there. So we got syringes in here, we got vials, we got needles, we got ampules, we got biopsy forceps, we got hot and cold snares also. So what exactly looks like in here? So it's a mixed waste, isn't it? In here, in this picture, it's a clear bag. You know this bin bag, isn't it? This is a transparent bag. That means it's in a recycle bin. So you can see that there's only 2 water bottles in there. And that's like months before in the endoscopy department at the end of the day. So in this picture, what I want to depict is like at the end of the day, we only had 2 bottles in this transparent bag or in the recycle bin. That means all the other water bottles has been mixed with the clinical waste. Okay, so and you know these bins also, we got the black bins also, that's for the domestic uses and domestic waste, and we got the not the yellow one. So yellow ones and the orange ones are the similar ones for the clinical waste. So in the recycle bins there are plenty of like all of our staff members are having confusions regarding the proper waste management or what all things can be going to the recycle bin, because of the lack of knowledge. What we tend to do is we tend to put all the domestic waste and we tend to put all the clinical waste also into the recycle bin sometimes. Yeah, we tend to see that. And also we tend to put all the recyclable waste into clinical waste bin also, like getting mixed up. So what all the waste can go into the recycle bins now? So non-confidential papers and cardboards, plastic water bottles, instrument packaging, these all can go into this transparent bag or into the recycle bins. Okay, and what we can do, so as I have mentioned before, introducing recycle bin in each procedure rooms and other areas. So in treatment center endoscopy, and while I have worked in city endoscopy also, I have seen we got like recycle bins, green recycle bins in every rooms and all other areas also. So the only thing is just to try to avoid mixing up of waste in each of the bins also, because if the recycle bin is filled up with food waste, then they won't be able to process the recycle bin properly, so that might need to go to the clinical waste also, and it's going to end up be costing up further for the trust or for the NHS also. Yeah, so if we are mindful with disposal, or what all clinical waste or what all recyclable waste can go into separate bins, that'll be so much helpful. Okay, and educating each staff member regarding updated waste management policy in NUH also, introducing a team to monitor the proper waste segregation in the unit. We will be coming to regarding the team sooner, and working along with the green NUH plans. So I'm just going to show you a proposed waste segregation scheme now. This is only a proposed picture, so endoscopy waste segregation. So the waste segregation, as I mentioned, so it's all the waste segregations are subject to the local policy or to the trust policy. So this is only a like kind of a model. So in here I've depicted some stages of disposal also. So because like before our endoscopy procedure, there are certain time beings in it, certain stages are there, like we got pre-procedure. So I have depicted all the waste in green color that can go into the bins as pre-procedures, okay, just for an example. And once I have depicted in blue color, blue font, are peri procedures. So like it can be pre-procedure, it can be during procedure, or it can be like intra-procedure, or it can be post-procedure also. Those all comes in blue. And the violet color in here is going to be the post-procedure ones, okay. And the black lettered ones can be disposed at any time. So these all things as a pre-procedure, like glove boxes, drug boxes, paper non-confidential, plastic ampules. So plastic ampule means, you know, like the water for injection. There are normal saline 0.9% 10 ml bottles are there. So those all are plastic ampules. Yeah, so it's not the sharp ampules or not the glass ampules. Okay, and the instrument packaging, water bottles, everything can go into this clear or green recycle bin. So these all can go there. So paper exclusively mentioned in here, it need to be non-confidential. Okay, so this is the next one in cream or gray. This is a single use waste bins, what I have mentioned before. So we can avoid mixing up of all the clinical waste or the sharps bin with vials, ampules, needles, and biopsy forceps or guide wires or snares or everything into it. So most of the NHS hospital have started using these single-use bins also, or single-use plastic bins also, because that can be recycled. So we need to have a proper look into it as a long-term plan, so that will be helping to avoid most of the landfills or into the ocean fills also with most of the waste. So the accessories which can go into the cream or gray bins are, you can see that in here. So that can be, as I mentioned, post-procedure, like biopsy forceps, guide wires, snares, balloons, gold props, baskets, cannula, stent introducers, graspers, cytology brushes, dilatation equipments, and sphincterotomy. And in the domestic waste, you can see, like as I mentioned, black dots can be disposed at any time. Food waste, disposable coffee cups, everything need to be going to the black bin. And you also know that the clean aprons, paper towel, tissues, couch roll, non-recyclable packaging, lubricating gel packaging, everything can go into the domestic waste bin or into the black bin also. So this one is like what we use as like yellow or the orange bags or the clinical waste that need to be gloves, aprons, gauze, absorption pads, NG tubes, PEX, stoma bags, contaminated blue roll, suction tubing, oxygen tubing, nasal cannula, mask, mouth guard, suction liners, poly traps, suckers, large syringes. So coming up to the main thing is the NTNOx. NTNOx is an important greenhouse gas with approximately 300 times the greenhouse effect of carbon dioxide, and it is estimated to persist in the atmosphere over a century, and also destroys the ozone layer, ongoing ozone depletion also. So it also accounts for nearly half of the medical gas footprint from hospitals. So what exactly happens is with the NTNOx is because most of our staff are not aware of what impact can NTNOx do into our atmosphere. So what we have done recently was, because of the national shortage of mob, we tried to call them and inform our patients regarding that we won't be able to provide gas and air, because why we did that was because we have already provided them the leaflet along with the appointment letter, like you'll be able to use the gas and air during the procedure. So we need to tell them, because of the shortage, like we won't be able to provide that, and that's the only reason we have stopped using gas and air or pulled back using gas and air for our patients. But along with that, there's another huge side why gas and air need to be limited or reduced, or is there any alternative, like we can use the gas and air without any kind of harmful effects. So there are certain ways, so we can see what we can do in here. Okay, so introducing mobile destructing unit in which the exhaled nitrous oxide will be destructed into nitrogen and oxygen. And as you know, this nitrogen and oxygen are safe in the environment also, or in the atmosphere. The only greenhouse gas is the nitrous oxide, that means the NTNOx. This is the mobile destructing unit machine. So in here you can see that this so I took these pictures because we just want to have a proper clear idea how much space this machine is going to be taking. So in here you can see a circle in here, so that's the space for keeping the gas and air or the NTNOx cylinder. So it will be connected into the NTNOx cylinder, and what we'll be giving is we'll be giving the host or the mouthpiece into the patient. So the patient will be having the mouthpiece in place, and once they have the gas and air, inhale the gas and air, we will tell them to exhale the gas and air through the mouthpiece or into the hose. Yeah, that's the thing what we are going to tell them. So what happens is, this is a machine, so once the exhaled gas and air goes into the machine, it will destroy the exhaled nitrous oxide into nitrogen and oxygen. So that will goes into the atmosphere. That is, this machine is going to be converting it, filtering it 99.6%. So this machine is mainly or recently introduced, not recently, in 2021 it's been recently introduced into one of the hospitals, NHS trust hospitals in Newcastle. So they have introduced into the maternity department also. So as a part of our shared governance also, I have introduced this topic into the shared governance team, and the shared governance team is so happy to put forward this project in place. So once because we are currently trying to form a council, shared governance council in the treatment center endoscopy. Once we form a proper council, they are happy to liaise with us regarding this project. So I need to go forward with our stakeholders in endoscopy department and discuss all the informations regarding the usage and regarding the machine, what all things we can introduce. So everything will be liaised properly. And also I have already informed the improvement lead also in the Nottingham University Hospital, and also the Green NUH is aware of the same project. So these all peoples were participated during the shared governance council, so it was so easy for me to present this topic, and they were tremendously happy to look forward into it. So hopefully, fingers crossed, once we have a proper council, we can look forward to start this project, and we can hopefully we can introduce this machine into our department also. So, and coming to the next point, so educating patients, as I mentioned before, we need to educate our patients regarding the impact of NTNOx to environment and help them in taking a wise decision. Whether if they got a backup, they can have a to accompany someone to take them back home. They can have sedation, or if we have any in near future, if we have the machine in place, we can still offer them gas and air, and they can use it. Also, we can tell them many different measures, like focusing on breathing. And if in case of severe pain or something, we can offer them paracetamol in regards to allergies or in regards to the interest of the endoscopist also. So there are certain many other ways we can tell to the patient or avoiding or educating the patient regarding the impact of endonox to the environment also. Okay, and coming to the next point, paperwork and PPE. So 30% of all hospital waste is paper. We all know that, like how much paper we are generating in a single day, starting from a patient journey, booking patient in the procedure room, or coming to the recovery, discharge. How many papers we are using is only in the endoscopy department. So 30% of all hospitals waste is paper. So this has led to the NHS goal to reduce the paper use by 50% by the year 2022. So it's been already started. So we are still in the calculation, still waiting for the calculation how much we have reduced. So we use high volume of single-use PPE during endoscopy, including face mask, gowns, aprons, and gloves. And a recent 6-month study indicated that generation of 591 tons of CO2 equivalent per day, with the biggest impact from gloves, aprons, facial, and masks also. So what we can do? So we can go digital, paperless endoscopy unit. So that's a long-term plan also. And such a system will have the added benefit of efficiency, ensuring quality control and reducing labeling errors also, reduction in PPE where possible, and maximizing availability of reusable PPE in endoscopy. Paper use also, as I mentioned, during the procurement also. We can even get the recycled paper. We currently use the recycled papers everywhere. For taking the printouts also. So that's a good sign that we go through with the proper safer atmosphere side also. And also we can be mindful while taking double-sided prints also, so that can save a huge number of wasting papers also. Okay, so that's some of the short steps what we can do earlier. Okay, and coming to the next point is knowledge about waste management among staff members. So recent survey of healthcare staff across 4 main hospitals found that 57% of staff reported being unclear on what items are recyclable in a procedure room. Okay, so that's what I have explained previously also. Like months ago we had issues like most of the clinical waste being mixed up with the recyclable waste also. So now it's been changing all around, but with a proper information system. So what we can do for that, complete training packages on e-learning. There are many of the options, like we can go with what all the hospital waste management system, how we follow NUH policy, everything will be there in the e-learning, so we can complete with that. So all of our staff members will get a proper idea. And linked role for Green Champion, that we are planning to start sooner in all of the endoscopy departments, and creating an information board which can be updated weekly, and introducing fun quiz within the department to update knowledge. So what we can do as a team, that's what we've been discussing all throughout. So the 3 R's are the main important things. So reuse, reduce, recycle, this is the slogan. So with education, proper education, what we can do is we can minimize the waste and we can maximize sustainability also. And with proper research and proper learning, we can enable the improvement and we can develop collaborations also. So these all factors will be much helping the endoscopy to get a proper sustainable department. What is the NUH Green Team? So we can introduce the Endo Green Champions by collaborating with the NUH Green Team also. So the Green Champions, if the endoscopy department got the Green Champions, it will get like the endoscopy department will get more add-on points in the JAC accreditation and in the global rating scales also. And the NUH Green Plan's main goal is to ensure the key infrastructure investment decisions are future-proofed in terms of sustainable efficiency. That's the main thing now. So this means less wastage of resources, time and money. And by 2045, the NHS commits to achieve net zero within its supply chain. Practical tips for a green endoscopy unit. So this is just a depict model what all things we can practically introduce in a short-term plan or in a long-term plan into the endoscopy unit. So this is just a picture of the endoscopy procedure room or a complete unit in here. I hope the picture is a bit more clearer and I can read on with all the points. So starting from the decontamination, so what we can do is like what all the things what we can introduce it like innovate and optimize the process to minimize the plastic, water and energy usages in there, and having a proper recycling culture. So as I mentioned before, we have introduced like recycle bins in every rooms and every other accessible areas to avoid any kind of unnecessary mixing up of waste. and so that the waste segregation will be so much helpful. Okay, and introducing green champions. So as I mentioned, we'll be planning to prepare the green champions also, because the champions can help the team members with waste allocations and support other sustainable practices as well. Okay, and minimize histopathology. So why histopathology? Because local protocols can minimize the inappropriate use of histopathology in clinical pathways, because there is a fact saying that in some of the researchers is like processing a single histopathology pod is equal to running 3 to 4 miles in a car or burning the fuel for 3 to 4 miles. So that's one of the calculation one of the researchers I have seen, and so that's why minimizing histopathology will be also a good practical tip for a green endoscopy. So like having a procedure also to, so like we can avoid certain colonoscopy procedure for the patient, like whether we can have a, according to the endoscopies, whether they can have a capsule endoscopy, or whether they can have a cytosponge, or whether they need only a CT colon. So it depends upon the clinical needs of the patient, and we can help to avoid using more of the procedures also, and that can reduce more of the waste also, and that can promote the green endoscopy unit. So, and evaluating nitrous oxide use, we have discussed regarding the Entonox usages also, like considering substituting nitrous oxide for lower impact methods to increase the comfort levels also. And if there is the mobile distracting unit, we can still offer the Entonox also, but otherwise we can still tell them or educate them regarding the impact of the gas snare into the atmosphere. And teaching and training wise, like take advantage of endoscopy simulators and digital image libraries also. Procedure planning to like we can also procedure planning to reduce waste can be incorporated into training, like simulation what we are having for this training purposes, for the procedure wise and everything. For the waste management also, we can have a simulation training, or we can have a session inside our department also, so that all the staff members will be knowing regarding the proper waste management technique. And going digital, we have discussed regarding the same thing. Maximizing appropriateness, like adherence to like relevant professional guidelines, can ensure clinical appropriateness for all endoscopic procedures. And building and estates, we need to be in liaise with the building and estates also. Paper and printing, we have mentioned regarding that. And renewable energy, usage of renewable energy also, in case if we got renewable energy sources. And sterile water, that's one of the main thing, because we use tons of water bottles in a month, or in every day, or in a week calculation. So in here, as a future plan, it's mentioned as like reduce consumption of industrially produced and packaged sterile water by exploring options for on-site production of potable water. So that will be so helpful to avoid more usage of water bottles also by industrial purchases. And responsible purchasing, that's one of the other thing, like the procurement is one of the main thing in here. Should seek consumables which are created and supplied with minimal environmental impact and made from materials that are recycled, sustainably sourced, and are recyclable at the end of the use also. That's also a good factor, or the good practical tip for a green endoscopy unit. So these all are the most of the practical tips what we can introduce into the greener endoscopy, or we can make a green endoscopy unit. So I hope I have explained most of the points in here, or most of the points for managing sustainability and environmental impact within endoscopy unit. And thank you for listening to the session. And if you got any questions or queries regarding this topic, we are happy to clear any of your doubts also. So I hope I have explained everything regarding the managing sustainability and environmental impact within endoscopy department. And I hope for the further or upcoming days we can get all these measures or all these practices into effect in our endoscopy departments also, in all the different sites. So that will make our endoscopy department more greener, so that we can fulfill, or we can liaise with the NUH green plan also. Okay, so thank you so much for listening. So these are the references what I have gone through, and thank you so much Debs and Natalie for providing me this opportunity to present this topic. Thank you so much. Thank you everyone. Thank you.